Welcome to the examination of stoma. By definition, stoma is a surgical opening made in the small intestine, in the ileum, or in the colon to evacuate fecal material and gases to the abdominal wall to be collected in a special appliance collecting bag. The indications for colostomy are either distal congenital anomaly such as rectal atresia or anal stenosis, distal injury of the rectum, distal anastomosis of the rectum and colon, or we have tumor such as CI rectum and excised, and we have to bring the fecal material to the outside by end colostomy. We have either the ileostomy and we have colostomy. Types of colostomy are either temporary or permanent, loop colostomy or end colostomy. The colostomy is made flush with the abdominal wall, while ileostomy should have a spout. The complications of colostomy, either there is stenosis or paracolostomy hernia or protrusion or retraction or bleeding or infective diarrhea. Usually for the temporary loop colostomy we keep it for 2 months, and after the distal injury become healed, then we can close the colostomy by another operation. First, the preliminary steps. Greetings to the patient. Introduce yourself. Take permission for examination. Position of the patient supine. Exposure of the abdominal wall. And wear gloves. Start first by inspection. You remove the bag, you remove the dressing, and see whether the ileostomy or colostomy is functioning or not. So this is the bag, collecting bag of colostomy. To collect the fecal material, it is disposable. At first you remove it, throw it away. By inspection, see the site of the stoma. An ileostomy usually located at the right iliac fossa, while colostomy either in the right hypochondrium involving the transverse colon or in the left iliac fossa involving the sigmoid colon. So first, the site, and see whether by an inspection whether there is any narrowing, any bleeding, any retraction. Ask the patient to cough any hernia, Now we come to palpation. You wear a glove and come to palpate for tenderness, for temperature, for hardening of the site around it, means malignancy, and introduce your finger in the ileostomy and in the colostomy to see whether it is end colostomy or it is a loop colostomy. The final steps of examination is to return the bag to the colostomy, cover the patient, and through the gloves wash your hands. Thank you.